It is expected that in 2023, roughly 1,040 children will die because of cancer, making it the second leading cause of death in children. As a child, as a child advocate, it is important to me that we are equipped with tools to help children, all children. According to the American Cancer Society, about 9,910 children in the United States under the age of 15 will be diagnosed with cancer in 2023. Childhood cancer rates had been rising slightly for the past couple decades, but have stabilized since 2010. St. Jude's Children's Hospital has made advancements through their treatment, research, and training to help cure um, cancer as well as other pediatric diseases. Treatment and care, St. Jude offers uh, care specializing in terminal illnesses like leukemia and brain tumor treatment. St. Jude is one of the leading treatment and care centers for children with leukemia. They specialize in treating different forms of leukemia, including uh, difficult to treat cases. According to the Children's Hospital of Philadelphia, children with leukemia can have fevers and trouble fighting infections. These are less healthy red blood cells to carry oxygen, and children with leukemia can be pale, tired. There are less platelets to stop bleeding. Children with leukemia can bruise and bleed easily. Leukemia affects the systematic um, system as well as the lungs, muscular, bones and joints, psychological, lymph nodes, spleen and liver, and skin. Treating treating brain tumors. St. Jude requires specified care when treating brain tumors. They specialize in medulloblastomas. According to the Boston Children's Hospital, medulloblastomas account for 15 to 20% of all pediatric brain tumors and occurs most commonly in children between the age of 3 and 8, but can be seen in children and adults of any ages. There are about 350 cases of medulloblastoma diagnosis each year in the United States, which is why research for uh, pediatric diseases is important to establish in the United States. Research in pediatric cases at St. Jude's have impacted the way patients are treated today. Pediatric Translational Neuroscience Initiative is an initiative that helps with determining DNA gene mutations and finding out what the causes of them are to be able to prevent diseases. According to St. Jude Hospital, catastrophic neurological disorders in children are amongst the greatest medical challenges of our time. Many of these have a genetic contribution, often driven by a single gene mutation, particularly in pediatric cases. St. Jude, it has been invested in their advancement of sickle cell disease, understanding and understanding, curing, and treating sickle cell disease. Sickle cell disease turns regular red blood cells, which are round and flexible, into sickle cell uh, shaped red blood cells that stiffen, changing shape into sickle cell or crescent shape. According to St. Jude Hospital, scientists at St. Jude Research Hospital have unveiled a link between the HIF1 protein response to low oxygen conditions, increased expression of fetal hemoglobin in adults, potentially paving the way for innovating treatments in sickle cell disease and beta thalassemia. These tr- these research um, These research advancements have been a part of why St. Jude is one of the most sought after pediatric children's disease sites in the United States. Because of this, St. Jude has improved their training and care. Training and care in St. Jude's is something that they're very invested to open way for the new era of scientists that will be providing care for the future. St. Jude has a program called the St. Jude's Global for children low and middle income countries. St. Jude has launched an initiative to improve care and treatment for children in these countries. According to St. Jude's Hospital, worldwide, more than 90% of children with cancer live in and mm, live in low and middle income countries. Too many of those children lack access to adequate diagnosis, treatment, and most of them die because of the disease. In order to help avoid any more deaths in the hands of inability to acquire adequate health care, St. Jude has launched their St. Jude Global Initiative that provides training and supplies as well as scans and other treatments for children in other countries that don't have access to them. St. Jude Children's Hospital is also determined in beginning to educate the future scientists that will be paving way for research in pediatric diseases. St. Jude's Children's Research Hospital Graduate School of Biomedical Sciences. Students are welcomed into these programs based on their choice of study, whether it's clinical investigation, global children's health, biomedical sciences. These are programs that are focused to the advancement in treatment for pediatric diseases. St. Jude is invested in their research to continue to provide a quality of care, treatment, and potential cures for pediatric diseases such as brain tumors, leukemia, and sickle cell diseases. Meanwhile, providing these tools to children who would not receive them if it wasn't for their global initiative. St. Jude is the saint of lost causes, which is why it is adequate that St. Jude Hospital is invested in making sure there is no lost cause. I encourage that you act on this and donate to this cause. As little as $10 a month can make a change. You can donate using the www.stjude.org/donate website, or you can also donate over the phone at 800-805-5856. Thank you for your time, and I hope you make a donation.